Psychedelics are a class of drugs that can cause profound changes in perception, mood, and thought. These substances have been used for thousands of years in various cultural and spiritual contexts, and in recent years there has been a resurgence of interest in their therapeutic potential. Psychedelics work by altering the way that the brain processes information, particularly in the prefrontal cortex, which is responsible for executive functions such as decision-making, planning, and self-awareness. By disrupting these normal patterns of thought and perception, psychedelics can facilitate new insights and perspectives on oneself and the world. Some of the most commonly used psychedelics include LSD, lysergic acid diethylamide, psilocybin found in magic mushrooms, DMT, dimethyltryptamine, mescaline found in peyote cactus, and ayahuasca, a brew made from plants in the Amazon basin. These substances are illegal in most countries, although some are used in religious or shamanic ceremonies in certain cultures. The use of psychedelics has been associated with a range of experiences, from profound spiritual insights to intense anxiety and paranoia. These effects can vary widely depending on the individual, the dose, the setting, and the quality of the drug. In recent years, there has been growing interest in the therapeutic potential of psychedelics for treating a variety of mental health conditions, including depression, anxiety, addiction, and post-traumatic stress disorder (PTSD). This research has largely been driven by the work of organizations like the Multidisciplinary Association for Psychedelic Studies (MAPS) and the Beckley Foundation, as well as by individual researchers and clinicians. One of the most promising areas of research has been the use of psilocybin for the treatment of depression and anxiety. Clinical trials have shown that a single dose of psilocybin, administered in a carefully controlled setting, can produce significant reductions in symptoms of depression and anxiety that can last for several months. Similarly, research on the use of MDMA, ecstasy, for the treatment of PTSD has shown promising results. MDMA has been shown to enhance feelings of trust and empathy, which can facilitate the therapeutic process in individuals with PTSD. Despite these promising results, the use of psychedelics in a therapeutic setting remains controversial. Some critics argue that the risks associated with these substances, including the potential for adverse psychological effects and the risk of abuse, outweigh any potential benefits. Others argue that the current regulatory framework for these substances is overly restrictive, and that more research is needed to fully understand their therapeutic potential. Overall, the use of psychedelics remains a complex and multifaceted topic, with both risks and potential benefits that must be carefully considered. While there is still much to learn about these substances, the growing body of research suggests that they may have a valuable role to play in the treatment of mental health conditions.